Memorial Day is the unofficial start of summer, and if you're heading outdoors this weekend, you do need to protect your skin. Dr. Jerome Patoskin, board-certified dermatologist and spokesperson with the Skin Cancer Foundation, is here on this Don't Fry Day. Thank you for coming in today.
Thank you.
I think we can kind of guess what Don't Fry Day is about, but tell us a little bit more.
So Don't Fry Day caps off the month of May, which is Skin Cancer Awareness Month. And it's really to raise public awareness about the dangers of the sun and not to fry your skin. It tends to fall on the Friday before Memorial Day, so this weekend.
Okay, so what is the single best thing that we can do when it comes to lowering our skin cancer risk?
So the single most important thing is to avoid UV exposure, and that can come in two forms. So number one, we live in the Bay Area. There are so many great outdoor things to do. I recommend people do what they love, but avoid the peak sun hours between 10 a.m. and 4 p.m. And by all means, do not frequent tanning beds. Tanning beds to the skin are like smoking is to your lungs.
Okay, yeah, that's a good way to put it. So what is the best type of sunscreen that's available to consumers out there if they are going to be out during the time when this is most affecting them?
So that's a great question. I would say simply the best sunscreen is the sunscreen that you like, that you're going to use, that has an SPF of at least 15 for everyday use and an SPF of 30 if you're going to be out for an extended period of time. And you want to make sure the sunscreen is a broad spectrum sunscreen that filters out both ultraviolet A and ultraviolet B radiation.
Okay, so look for the UVA, UVB, and how often should we be reapplying during prolonged sun exposure?
So I'd recommend, first of all, applying it 30 minutes before you're going to be exposed to the sun, and then reapply every 2 hours. If you're swimming or at the beach, I'd recommend reapplying it after you get out of the water, or if you're sweating a lot, reapply after you're sweating.
Okay, do things like hats actually help? Is that just an extra layer? You can wear a hat, but don't skip the sunscreen, obviously?
No, hats are really important.
Okay.
I treat a lot of skin cancer on the scalp, and the only way to truly protect your scalp, particularly for people that have some thinning hair, is with a hat. And I also recommend a broad brimmed hat, so it kind of creates a shade to keep the sun off of your face.
Okay, and quickly, some of the sunscreens are sprays, others are lotions you rub on. Is there really one way you should go on those?
Well, I like to keep things simple. So for like my body and for my kids, I like the spray-on sunscreens. But for my face, I prefer a non-aerosolized sunscreen that I can apply exactly where I want it.
Okay, and are you seeing more cases of skin cancer these days?
Yeah, in fact, there are about 5 million new cases of skin cancer diagnosed in the United States this year, and we do see it on the rise. We particularly see it on the rise in younger people and in sunny areas like where we live.
Okay, all right, Dr. Patoskin, thank you so much.
Thank you so much.
Coming in on this Don't Fry Day and giving us all the details on that. Thank you.
Thank you.